Good morning, ladies and gentlemen. Thank you for joining us today for our annual Eye Care Day. My name is Dr. Kiew, Yean, and I am an Associate Consultant at Singapore National Eye Centre. For the next 10 to 15 minutes, I'm going to give you a brief introduction to glaucoma, a condition often known as the silent blinding disease. First, let us begin with an overview of the structure of the eyeball. The eye is essentially a ball which is filled with fluid, and the structures within the eye are analogous to the structure of a camera. The front surface of the eye, the clear portion through which we look, is known as the cornea. Behind this, the iris and pupil form an aperture or a shutter. Behind that, the lens provides focusing power. Age-related clouding of the lens is known as cataract. The retina is part of the eye similar to the film in a camera or a sensor array. It converts the light that we see into signals that can be processed by our brains. The optic nerve is like an output cable. It carries all of these information to the brain, and this is the part that is damaged in glaucoma. For someone to have good vision, all components of this system must be working well. The eye is a ball filled with fluid. This fluid is constantly being produced by the cells behind the lens, and this fluid bathes the entire eye, nourishes it, and then exits the eye through the trabecular meshwork, which is located in the angle of the eye between the cornea and the iris. The intraocular pressure, or pressure within the eye, is a balance between fluid production and drainage. Glaucoma occurs when the pressure within the eye is abnormal, resulting in damage to the optic nerve. This damage is irreversible. Now, in a normal person, there is a gradual decline in visual function with age. At the bottom of the graph, the gray box represents severe visual impairment. For example, when someone might be unable to drive or have difficulty with daily tasks, or if they reach the bottom of the chart, complete blindness. You see from the graph that if the eyes are healthy, the normal person never reaches severe visual impairment in their lifetime. In glaucoma, there is progressive damage to the optic nerve and vision is lost. Some patients with glaucoma progress very slowly, and even though they are losing vision much faster than a healthy person would, they also never reach severe visual impairment in their life. Some glaucoma patients progress more rapidly, and in these cases, without treatment, vision is lost, and the patient may spend some years of their life with severe visual impairment or blindness. The aim of glaucoma diagnosis and treatment is to find these people who are likely to progress rapidly and who are at risk of blindness and reduce the rate of progression, so that, like this yellow line here, we can avoid severe visual impairment during their lifetime. What causes someone to have glaucoma? Sometimes this can be inherited due to imbalance between the production and drainage of fluid, leading to high eye pressures with damage to the nerve. Some people have nerves that are more prone to damage, for example, due to problems with blood flow, breathing problems at night, or due to extreme myopia. Other people have an eyeball shape that predisposes them to blockage of the drainage angle, known as angle closure glaucoma. We will discuss this in more detail shortly. Sometimes in other people, glaucoma may be caused by other diseases affecting the eye, such as inflammation. In open-angle glaucoma, although there is an imbalance between fluid production and drainage within the eye, the drainage pathway is not blocked per se. This is rather like a slowly flowing sink. In angle closure glaucoma, on the other hand, The shape of the eyeball is such that this drainage pathway is narrow and may be obstructed so that fluid cannot flow out. This can lead to high eye pressures, either suddenly if the obstruction happens suddenly, or gradually over a number of years. When the eye pressure goes up suddenly, this is accompanied by severe pain, headache and vomiting, red eye and blurring of vision. As in this photo, the right eye is an eye that is undergoing acute angle closure glaucoma. In many cases, the eye pressure at this time may be extremely high, and a lot of damage occurs to the optic nerve within a very short space of time. In these cases, we need to urgently lower the pressure with medications, after which we need to treat the underlying angle closure. This is done using a laser procedure known as an iridotomy, in which a hole in the iris is made to open up the drainage pathway of the eye. Image A is a scan taken from a patient with angle closure, and image B shows the same patient after undergoing laser iridotomy. As you can see, the drainage angle of the eye, which was narrow before, has become much wider after having the laser procedure done. Although some patients have sudden onset glaucoma, most of the time, however, in open angle or even angle closure glaucoma, the eye pressure goes up very gradually over time, and damage to the optic nerve happens very gradually without pain. This damage leads to visual loss that starts at the peripheries of our vision. These pictures show on the left what a normal person sees, and on the right, what someone with moderate glaucoma might see. At the bottom, what someone with severe glaucoma sees. As you can see from the pictures, a person with moderate glaucoma may not notice the red car parked at the side, and even the children are not well seen. The field of clear vision is even smaller in the individual with severe glaucoma. Because the central area of vision is affected last of all, many people do not know they have glaucoma until it is very advanced. This is the reason why glaucoma is also known as the silent thief of sight, or the silent blinding disease. Because glaucoma is so often asymptomatic, with most patients not knowing or not having any symptoms at all, most eye doctors or optometrists will routinely check for glaucoma at each visit. This involves an examination where we look at the eye, we check the eye pressure, and assess the health of the optic nerve. On the bottom left is a picture of a healthy optic nerve. In contrast, in someone who has glaucoma, the nerve may look more like the right side picture, where it is thinned out due to damage. We also do various tests, such as a visual field test, seen here, where we show lights at various parts of the vision to see if there are any areas of damage or missing areas. These are some examples of visual field test results. White or light areas represent areas with normal vision, and black areas represent areas of damage or loss. In effect, these are blind spots which the patient cannot see. The more advanced the damage, the faster the subsequent progression, and the sooner the individual is likely to reach the level of severe visual impairment in our graph earlier. Other tests for glaucoma include taking pictures or scans of the optic nerve and doing tests to determine the risk of progression of each individual, such as measuring the thickness of the cornea. When you come to see us in our clinics, we might ask some questions to see if you are at risk of glaucoma. For example, if you have a family history of glaucoma, other health conditions you may have, and to find out whether, if you do have glaucoma, whether you are at risk of rapid progression. The doctor will then examine your eyes, send you for various tests as required, and then go through the test results with you. If someone has been diagnosed with glaucoma, what happens then? Remember that damage in glaucoma is irreversible. The aim of treatment is to stop or slow down the progression to preserve remaining vision, but we cannot turn back the clock on past damage. All glaucoma treatment works by lowering the pressure within the eye. This is often done using eye drops. There are many types of glaucoma eye drops, all of which work in different ways. It is very important to use them exactly as instructed to make sure they work correctly, to lower the eye pressure and protect the nerve from further damage. Sometimes laser procedures may be carried out. These can either be done to improve fluid outflow, as in the case of laser iridotomy mentioned before, or in some cases to reduce fluid production to lower the eye pressure. If all of these fail, glaucoma surgery may be done to reduce the eye pressure further. This can take the form of traditional glaucoma surgery or minimally invasive glaucoma surgery. In traditional glaucoma surgery, a new drainage pathway is opened up to help drain fluid from within the eye. This can be done by making a channel within the tissues of the eye itself for fluid to drain out. This is known as a trabeculectomy. Or we may insert a silicone tube into the eye to drain the fluid out. This is known as tube shunt surgery. Minimally invasive glaucoma surgery refers to the placement of small devices that help to drain the fluid and lower the pressure. Unlike traditional surgery, the implant is very much smaller and the risks of surgery are lower, but the reduction in eye pressure achieved is also much less than that of traditional surgery. This is one such device. On the right is a picture of the actual implant on a coin to show the true size of the implant. Here is another different implant that might be used. As you can see, the implant size is tiny. It is placed within the drainage angle of the eye to improve fluid flow through the existing natural drainage pathways. When thinking about what treatment might be required, it is important to remember that every individual is different. There are many different types and stages of glaucoma, each of which require different treatment approaches, and what works well for one person may not work as well for another. After a complete evaluation, your eye doctor will advise you on the best options available for your specific condition. The first line of treatment is often eye drops for many of our patients. Thank you very much for your time and attention. At this time, I am happy to take any questions in the chat. So, there's quite a number of questions. I think let's go through some of them. We may not be able to get to all of them. Following on from the previous talk about cataract, there are a number of questions about glaucoma and cataract. The answer is yes, cataract and glaucoma can occur at the same time. Cataract is an aging change, and everyone will get cataract at some point in their life. So in some patients who do get glaucoma as well, they may very well have cataract and glaucoma. They are separate diseases, but treatment of one may help treatment of the other. Sometimes during cataract surgery, we may combine this with glaucoma surgery as required, and cataract removal can sometimes help in glaucoma patients as well. In terms of how to differentiate whether one has glaucoma or cataract, as mentioned, in most cases, patients with glaucoma have no symptoms. You may not know on your own. In fact, often you would not know. In patients with cataract, if the cataract is significant and affecting your vision, you will notice that your vision is blurred, both for distance and for near. At the time that you come to see your eye doctor doing a complete examination and evaluation of your eye would be able to discuss with you the presence of glaucoma and cataract, the severity of each, and what to do next, whether to treat the cataract first or to treat the glaucoma or to do both concurrently. In terms of eye drops, there are many types of eye drops. Different patients may need different combinations of eye drops. I would rather than suggesting it in a general forum, I don't think that's possible. I think that you should see your eye doctor, and they would make an individualized recommendation for you. There are eye drops that don't require refrigeration. In fact, most don't require refrigeration, but if you are keeping stocks of eye drops at home, they should be kept in the fridge so that, because you may keep them for a number of months so that they last and don't degrade over time. In terms of average years of patients with glaucoma losing vision, as mentioned, some people progress slowly, some people progress more rapidly. It is a challenge, it is our challenge, I guess, to find those who are going to progress rapidly. So there's no good answer for this. Some people may never lose vision completely if they're lucky enough to be slow progressors. In patients who are rapid progressors, maybe in a few years, they may start to have severe visual impairment. External bleeding of the eye, in terms of bursting of the eye vein, this is what we call a subconjunctival hemorrhage. This is not actually a symptom of glaucoma. It's quite common. It happens sometimes due to a sneeze or a cough, sudden exertion, rubbing your eye. Is not usually a cause for concern and unrelated to glaucoma. Vision glare during vision is not a sign of glaucoma. That can sometimes be a sign of cataract. It may be a sign of other things, sometimes dry eyes or other diseases within the eye can cause glare or sensitivity to light. In terms of myopia and glaucoma, people with extremely high myopia, the eyeball shape is elongated. And naturally, this longer shape of the eyeball, it leads to differences in the way that the pressure within the eyeball is distributed, the effect of the pressure on the nerve as the nerve exits the eye. So in these patients with a longer eyeball, they often have thinner walls of the eye as well, and the nerve is a bit more stretched. The nerve tends to be more prone to damage and more fragile, so to speak. The normal eye pressure from population studies is set at 10 to 21. All that means is that if you take many patients and you check all their pressures, and if these people don't have glaucoma, many normal patients, 95% of normal people have pressures between 10 and 21. But there are normal people who have pressures higher than 21, and there are normal people who have pressures lower than 10. And similarly, there is no one ideal pressure for the eye, either in a normal patient or in someone with glaucoma. For people with glaucoma, what we need to aim for is a pressure that is low enough so that the nerve no longer gets damaged, and that would differ from patient to patient. Glaucoma does not recover per se. Someone is asking what is the recovery time for glaucoma. So damage in glaucoma is irreversible. You can't turn it back. You can't, those black areas on the field test, they don't go back to white, even with treatment. But what you can do is you can maintain what you currently have with the medication, with the laser, with the surgery, to prevent further damage, to stop you from losing more. Once you know you have glaucoma, how frequently should you check with the doctor? Your doctor should give you a follow-up schedule. Usually that will be determined by how stable or not your eye is. Usually if someone has just been diagnosed, we may need them to come back more frequently to do tests, because we want to see whether they are in the rapidly progressing category or in the slowly progressing category. We want to see the effects of treatment, if the treatment is effective, whether there are going to be side effects, whether we need to change the treatment or adjust something. So in the early stages, if someone has been newly diagnosed, the follow-ups may be more frequent, and if someone is more stable and if we're not changing anything, we may stretch out that follow-up duration. In terms of how to prevent this disease, it's not really something, it's not affected by what you do or your life or your lifestyle or eat or the things that you do. I don't think that's a good way to prevent glaucoma per se. But in general, taking good care of your health, because the health of the nerves, someone with a healthier general health, healthier general nerve, may have more robust nerves that are more resilient to damage. Certain things that predispose to damage, things like breathing problems at night, people with sleep apnea, those should be treated. People with diabetes, high blood pressure, if these are very severe, this can affect blood flow even within the eye, so that can also predispose to damage. So I would, those are good to treat. No spray steroids. Steroids can predispose to glaucoma. In some people in a population, using steroids causes the eye pressure to go up, and elevated eye pressure for long periods of time can cause damage to the nerve. The only way to know whether you're one of these people or whether your eye pressure is normal or not would be to get that checked out. And I would recommend that if you're on long-term steroids, that you should have your eye pressure checked. Can glaucoma come back? Short answer is glaucoma doesn't go away. So yes, it's with you for life if you have it. In terms of onset of symptoms, no, there are usually no symptoms. So you wouldn't know if you have glaucoma until it is too late. Paracentral defect is a descriptive term. So in terms of the visual field defect, most of the time glaucoma starts from the periphery. You lose vision from the sides first. So someone who has paracentral defect means that the defect is close to the center of your vision. You would probably notice this more. It's just a description of where your blind spot on the area of damage is. So in your case, the paracentral defect would be a defect that is close to the center of your vision. Yes, after cataract surgery, one can still get glaucoma. Can we use on-the-shelf eye drops to prevent eye problems without checking the eyes? No. Over-the-shelf eye drops tend to be lubricants. They help for dry eyes. It wouldn't tell you whether or not you have any other problems with your eyes. Okay, I'm sorry, we don't have time to deal with the rest of the questions, but please get in touch if you have any further questions, if we can help in any way. Thank you very much.